everyone. You're welcome to July edition of the Yaba Voice webinar. I hope you're doing well. Can you just quickly type in the section your mood today? How you feeling? Just describe with the emojis how you are doing today. We're glad to have you join us on this episode. And like I said last month, this is the fifth year, so we're excited. I will still have a lot of things packaged for you. Just trust me. We're still coming big for you. This episode of the App Voice webinar is targeted at addressing a very, very special age group. And we want you to be able to sit back and enjoy this with us. Before I run up, I want to invite the medical director to formally welcome us to this webinar. Over to you, Dr. Olubenga Adekile Owoye.
Thank you very much, Dr. Kemi Akitoyese. Good day, everyone, and thank you for being on this platform. I welcome you to our regular webinar by Yaba Voice on mental health issues. Yaba Voice is a platform for mental health education, advocacy, and community outreach. It is a platform of Federal Neuropsychiatric Hospital Yaba Lagos, through which the hospital creates awareness and educates the populace on mental health issues. Today's topic is mental health in the elderly, breaking down the barriers and building support. Mental health in the elderly, breaking down the barriers and building support. As we all know, older adults, that is those aged 60 and above, make important contributions to society, either as family members, volunteers, and as active participants in the workforce. While most have good mental health, many older adults are at risk of developing mental disorders or neurological disorders or substance use problems, as well as other health conditions such as diabetes, visual or hearing loss, and osteoarthritis. Furthermore, as people age, they are more likely to experience several conditions at the same time. Globally, the population is aging rapidly. According to the World Health Organization, between year 2015 and 2050, the proportion of the world's population over 60 years will nearly double from 12% to 22%. Therefore, mental health and well-being of this category of people are very important. And in addition, approximately 50% of adults aged 60 and over suffer from one mental disorder or the other. So if this is the case, we want to address how to help this category of people today. In today's webinar, many questions will be answered. For example, who is an elderly? What are the peculiarities of this age group? What makes them prone to mental illnesses? And what are the mental health challenges of the elderly? How do we prevent such mental health complications? And what are the solutions for their mental health challenges? So to do justice to today's topic, our seasoned expert in the house, I have seasoned expert in old age psychiatry. Our first presenter today is Dr. Taiwo Odugowa. Dr. Taiwo Odugowa is a consultant psychiatric special grade 1 with over 25 years experience. She's an expert in old age mental health. Dr. Odugowa obtained a Bachelor of Medicine, Bachelor of Surgery from the University of Ilorin, a fellowship of the West African College of Physicians in Psychiatry. She is also an alumnus of Lagos Business School. She had a residency training at Federal Neuropsychiatric Hospital Yaba Lagos, appointed as consultant psychiatry in the same hospital, and rose through the ranks to become consultant special grade 1. Our area of specialization is the geriatric or old age psychiatry. She has attended many trainings both locally and internationally, She has been involved in some researches both locally and internationally. Dr. Oduguwa is a mental health advocate and she's passionate about service to God and humanity. She's married with children. Our second presenter today is Mr. Akin Gabriel. Mr. Akin Gabriel is a licensed clinical psychologist with about 20 years experience in the field. Currently, he is an assistant director in the Department of Psychology of the Federal Neuropsychiatric Hospital, Yaba, Lagos. He has passion to provide clients with individualized group psychotherapy to help them facilitate social and personal adjustment to live a more meaningful and fulfilling life. Presently, Mr. Akin Gabriel is a doctoral student in clinical psychology at the University of Ibadan. He also had a master's in clinical psychology from the University of Lagos and a first degree in psychology from the University of Nigeria, Nsukka. As a clinical psychologist, his major area of emphasis is on psychological evaluation, psychotherapy, training, and development. Apart from his regular clinic, he's also involved in an on-demand intervention, training, and teaching. Mr. Akin Gabriel is a mental health advocate and a public speaker. He loves traveling, poetry, and theater. He is also happily married with 2 children. And Mr. Akin Gabriel has many professional affiliations. To mention but few, he's a member of the Nigerian Association of Clinical Psychologists. He's a member of the Nigerian Psychological Association, a member of Employee Assistant Professional Association, and so on and so forth. You can see our presenter today, they are loaded with stuff. So I want to encourage all of us to kindly relax and listen to our mental health expert as we promise you a rewarding session of today's webinar. Over to you, Dr. Kemi Akintoyesi.
Thank you so very much, Medical Director, for that arousing welcome. And the Medical Director had intimated us with the concept that we are talking about today, and that is mental health in the elderly. Now, this webinar isn't just for the elderly. Please note that you are an elderly, you are an aspiring elderly, or you have elderly people in your domain. Please get seated. Get your paper, get your bios ready because you are in for a very good time. And again, please note that you can join us here on Facebook and also on Zoom. So either one works for us. You will be able to get information right from the horse's mouth. Our speakers are ready. I will go right into the conversation. Please also remember that you can drop your comments and your questions also in the chat box. Dr. Ojugwa, when we're talking about the elderly, we're talking about mental health in the elderly and the common mental health challenges with associated with the elderly. What exactly are we talking about? Over to you, Bob.
Thank you very much, Madam Moderator. Good afternoon, the acting MD, sir, and distinguished listeners. I'm happy to be back on this forum. So, as earlier defined by my acting MD, the elderly are those that are 60 years and above in this environment. However, some other environments will say 65 years and above. And some researchers have even gone ahead to subdivide them into the young old, which is 60 to 69 years, the middle old, 70 to 79 years, and the very old, which is 80 years and above. Now, when we talk about mental health in the elderly, it encompasses, a holistic approach to their health. What do I mean by this? One has to consider the physical, the psychological, and the social well-being of the individual. That's when you can say the individual has overall health or quality of life. So in essence, I'm trying to say that it's not only the absence of mental illness, but also the individual's ability to maintain relationships, cope with life's challenges, and the ability to enjoy life. Now, having said that, it is important to note that mental illness is not a normal part of aging. However, the elderly are predisposed, to having some mental illnesses. So I'll mention a few, and the top on this list will be depression, clinical depression, which is different from just unhappiness. It's a clinical condition. And it's so common in the elderly that it affects at least over 1 in 10 individuals. So the elderly are prone to loneliness, loss, and so on and so forth. And that's perhaps the part of the reasons, why the elderly are prone to having depression. Also, dementia, and people tend to use dementia interchangeably with forgetfulness. It's far more than forgetfulness. Dementia is a condition that affects the whole being. So dementia is, a condition that it has progressive decline in one's ability to think. We call that cognitive decline. It is also irreversible, and it occurs in clear consciousness. Usually, the memory problem, will be the first, thing to show in the patients. Sleeping problems, most often insomnia. They have difficulties initiating sleep, or maintaining sleep. Might be as a result of other health conditions or the medications they are taking. Delirium. This is a medical emergency which usually affects the elderly. The person, it occurs within the span of hours to days. And, the person might be so confused and agitated. It's a life-threatening condition. Sometimes the person might be drowsy, or slowed down. So one really needs to have that expert experience, to be able to diagnose an individual with delirium. Usually occurs, in patients with dementia or post-surgical, or patients that have, overwhelming infection like urinary tract infections, or pneumonia. Then we talk about things like drug abuse, though not so common in the elderly. Apart from the elderly being able to, or the elderly abusing things like alcohol, they abuse medicines like sleeping pills, laxatives, and so on. And it's worthy of note to talk about psychotic episodes in the elderly. We are beginning to see more of psychotic episodes in the elderly, especially with those that have sensory deprivation. And when I say sensory deprivation, those that have, hearing loss or they are visually impaired. So we are beginning to see more of those that have visual impairments and psychotic, features. They come up with vivid hallucinations, visual hallucinations, and these are seeing strange things in clear consciousness that other people around cannot see. And this is what we call the Charles Bonnet syndrome. Maybe I should just stop here. Thank you.
We are in for a very good time. But when she started mentioning all of this, things, my head started skipping because I'm looking at the future ahead. And that's why I said, please call somebody that is about to go into that stage, 60 or 65, then call children or people who are the elderly, so that at least they would also be able to understand that some of the things that they are saying currently may not just be out of place. They need this understanding, and that's why we are passing this information to the public, so that that sometimes when these people show a decline and other things like that, it's not quite unusual. It might be a phase in their lifespan that they're going through. And Mr. Gabriel will be talking about the factors that affect the mental health of the other. Now, why are they susceptible to this? Why are they prone to having this condition? Over to you, Mr. Gabriel.
Thank you so much. I really appreciate that. Future is bright, actually. And that's one of the reasons why we are talking about this now. We're talking about the future right now. No doubt about that. As a result of so many things that come with aging, that come with the elderly, some people tend to worry and have some, concerns. But maybe that's some of the, can I say, normal things of life generally at every developmental stage, right from childhood. See some of those things. Each of them with their peculiarities. Now we are focusing on the elderly, our dearly old citizens. And we are looking at one of some factors that may actually affect their mental health. There are some things that just come to us when you just remember the elderly, physical health. Most people's grandmas or granddads will have a bag or so of with medications for one condition or the other, heart conditions, maybe diabetes, pain, and all of that. So that's one of the major things that is associated physical health, and it's a major factor that that can affect mental health in people. The worries, oh, have I taken, have I skipped it? Some of the associated side effects of these medications too can have effect on mental health. Even the idea of, for some people, the idea of using medications may actually even do that. So the chronic illnesses like the heart disease, diabetes, arthritis, and everything can, oh, here I go again. I'm old. Feelings of, some beginning of feelings that are associated with negative feelings. For example, oh, I'm not so good anymore. I can't do all of those things I used to do anymore. Things leading to regret, things that may eventually lead into depression. So these are some of the signs that we can actually begin to look at once I ideally begin to make such complaints. We want to begin to, work with them to ensure that they don't actually lead into depression or some loneliness. Pain and disability are also part of it, especially the pain. Some of these pains can be so massive at times as a result of either arthritis or other associated illnesses. Oh, the medications are in some cases so much, and they have to take it. Now we are not talking only about the regular prescribed medications that your doctor will prescribe. We're also talking about the ones that some aunties and uncles will also bring when they are coming in from holiday from abroad, or with some of the village people bring on their way back some herbs here and there, and then they will take, just take this measurement and use it. All of this with their own mixture of effects here and there, leading at times to confusion, which one is even doing, which one's not. Some of the factors we're also talking about that may affect their mental health, of course, is social factors. Oh, one of our elderly ones, they are losing their friends, they are losing family members, their favorite cousins, their favorite aunties, their favorite, siblings. They are going. So bereavement can lead to depression, especially when it is not well handled. Because there are standard ways of actually handling bereavement. So once they're able to go through this, it will actually help. So bereavement, it brings some feelings of loneliness, some form of social isolation, especially when their dear ones have gone. They begin to feel lonely, and they don't have that former relationship, the talk, the chat, and all those their fun moments that they have together. It's no more. They begin to feel lonely. They begin to feel nostalgic as well. One other factor that may actually affect them in this case is about the caregiver. Now, caregivers on their own can actually constitute a major factor in mental health for adults. It can be stressful caring for adults. It can be. It can lead to feelings of frustration and eventually talk about abuse with the elderly ones as a result of this frustration associated with the work. With cognitive decline, some issues with dementia here and there, issues with memory and thinking. They adults begin to doubt themselves. They begin to have feelings with low self-esteem. They begin to feel worthless. If you see them withdrawing more to themselves, they don't want to talk to people that much. They stay on their own. They watch every other people playing from afar. And you see them maybe under the balcony, sitting there on their own chair, just watching and feeling the distance, from them. So that's some of the major, regular, everyday issues or factors that may actually lead eventually to mental health issues within adults. Let's pause there.
Thank you so very much, Mr. Gabriel. Now, it went from some physical to psychological issues that could most likely affect the mental health of the elderly. And I hope we're taking note because it's quite important to understand how all of these affect their health, because that would now lead us into understanding what are the signs and symptoms that's not specific to or more prevalent in older ones when we're talking about mental health. Over to you, Dr. Odrivora.
All the signs and symptoms on this forum, but I would take, some of the major diseases we have in the elderly. I'd like to talk about depression because it's pretty much, common in our environment. And people need to have an understanding so that when they see an elderly who comes up with depression, they can identify that patient and let the patient get professional help. So what are the symptoms that we see in depression? As I said earlier, it's different from unhappiness. So depression is when one has low mood most of the day, nearly every day, for at least 2 weeks. There's associated low energy and low drive. They lose interest in activities which they previously enjoyed doing before. Sometimes they can have low energy that it even affects mundane things like bathing. They feel too down or they don't have energy enough to take care of their grooming. And a lot of them come down with biological symptoms like poor sleep, poor appetite, and associated weight loss. Usually in the elderly, they might not come up with typical symptoms that we see in depression. A lot of them might come up with somatic symptoms, like headaches, digestive problems, chronic insomnia, chronic inability to sleep. And sometimes they say they feel unwell, they keep going up and down hospitals, telling doctor, I feel unwell. The doctors do all sorts of tests for them and they don't find anything. Those kind of adults, we should be screening them, for a depressive illness. Sometimes people might want to medicate their depressive feelings and, start abusing or misusing alcohol. Sometimes it can deepen, the depression could deepen, whereby the individual now starts feeling hopeless and helpless and worthless, right? And they have this inappropriate quietness. Now, these symptoms, the worthlessness, hopelessness, and helplessness, are usually a prelude, to suicide. So let's leave that for now. At least in a nutshell, I've tried to explain, the signs and symptoms of an individual who has depression. Now, I'm going to dementia, which is also common in these environments, and we see them a lot in our clinics. Now, as I said earlier, dementia is far, far beyond just forgetting things. It affects the whole individual. And I tell folks, that it can be a very, very devastating illness where the individual, becomes a shell of their real self. The substance in that individual flies away and you just leave a shell of the individual. So what are the early symptoms, of dementia? So one of the first things one will see is that the person starts forgetting things. The person starts having challenges with their memory. And you find out that a lot of them will start accusing people around the house, especially their house helps, of stealing their things, okay? Because they have misplaced them. They forget recent events and they forget or they have difficulty in finding words, the right words to say in the course of the conversation, okay? So sometimes they get confused, they might miss their way around the house, or they might go out and when coming back, they miss their way home. Yes, that happens, commonly. And they start showing difficulty, in carrying out everyday tasks, which they were doing, easily before. They now have difficulty doing everyday tasks. For example, the issue of managing money or, the issue of cooking. You find out they say, when mama cooks, sometimes she leaves the gas on or she forgets the food on the fire and the food burns. We should start looking at those kind of individuals closely. Now, having said that, at the middle stage of dementia, what do we usually see? Now, these memory problems and confusion, it further deepens. It gets worse. You find affected individuals, they keep asking the same question over and over again, in spite of the fact that you have answered the question, but they just keep asking that question. And sometimes people can actually get exhausted from those questions asking. People can get exhausted from them, answering questions over and over, the same questions over and over again. Now, in this hospital, at the Federal Neuropsychiatric Hospital in Yaba, a lot of the dementia patients we see have what we call the behavioral and psychological symptoms of dementia, whereby the patient now develops behavioral problems, which can be very, very, very problematic. They become agitated. They can become restless. They don't sleep at night. They are difficult, with their self-care. Sometimes you tell them, Mama, go and bath. Baba, they refuse to bath. They refuse to eat. So it can really be, difficult for people caring for them. Sometimes in their own home, they pack their things and tell you that I'm going out. I want to go home. Meanwhile, they're in their homes. This can be very, very problematic. They start to forget, the names of their children, the names of their spouses, and they lose track of where they are, and the time. They lose track of time and place. Now you find out that in this middle stage, they need more help with their activities of daily living. Now, in the latter stages of dementia, the individuals become more frail. They have difficulty in carrying out, mundane physical activities like walking, standing, sitting. They might be assisted, or they might need help, to achieve, those physical movements. So, the need for help in the activities of daily living is complete. They need complete help in the activities of daily living. Sometimes they lose bowel and bladder control. They remember very few words. They can no longer engage in conversation, but they remember few words. For example, how are you? They're able to say fine. You say bye, they say bye, and things like that. Okay? They also develop mannerisms, like grinding their teeth or chewing their clothes. Most of them, are prone to infection at this stage. They chew, they are unable to coordinate their chewing and swallowing. Sometimes when they chew and they want to swallow, they swallow into the wrong place. They not swallow into the airway rather than the digestive tract. And now they then can develop pneumonia from that, from aspiration. We call it aspiration pneumonitis. And a lot of them die, from pneumonia as a result of aspiration pneumonitis. Thank you.
Thank you so very much, Ma. And no, Dr. Dugo had been able to highlight to us some of the cardinal signs that you will see when the elderly at least is depressed. And for me, I think those are very genuine things that we need to be able to see, recognize, and be able to put into proper perspective. It's really when we start seeing some of the symptoms emanate from the elderly. I once had a concert with an elderly woman who showed her birthday. She was crying. She was really, really crying because she couldn't just control her bowel, and it felt ridiculous. She felt embarrassed. He took a lot for us to be able to get her to understand that yes, this is part of aging, and she could not comprehend it. Her words were, "What kind of aging is this?" Like somebody would say it in Yoruba, aging rather it was for her, it was quite ridiculous. But these are realities, realities that some people are currently going through, and understanding it helps us to be able to manage them effectively. Or is it when they start asking questions over and over again, the same words, the same questions that you have answered, they keep repeating it. And sometimes if you're not patient with them, then there's a tendency to lash out and be very angry with them. Now, this is part of why we are talking about all of this. Please note that people can still join, and then you can send your questions and your comments to the chat box. Our speakers are ready to answer and to address each of our concerns today. Now, Mr. King Gabriel will be talking to us about the most significant barriers that prevents the older ones from seeking help for mental health concerns, and then how can we break down stigma surrounding mental health in the older ones. Over to you, Mr. Gabriel.
Thank you very much, Madam Moderator. Yeah, some of the pictures can be a little bit, scary and worrisome at times. You can imagine that older citizens that you just described now, and then how they'll feel, as well as how others might also look at them. Perhaps maybe others with understanding might look with and look at them positively and be able to work with them, positively to get them beyond that. But unfortunately, it's not everybody that has such view about such individuals who are, doing that to themselves. So most of the time, the picture looks somehow. Even the whole picture of aging of the elderly looks somehow. To the extent that some people that talk about that the major barrier to seeking mental help among elder people is stigma. That negative way that some of us tend to look at certain people with certain characteristics, and maybe certain beliefs and stuff. We look at them somehow. We give them negative tags, and we have our own feelings as well as behavior towards them. Old people are one of these people that are actually stigmatized for being old, for being old, having some of those things associated with them. Oh, she can't remember things anymore. He's too irritable. He's too stubborn, and you hear such statements, especially amongst Yoruba folk, Otin Sharon, Martin Sharon, the more or less like you can translate to something like almost like Mama is getting demented, sort of, which can actually be derogatory at times and will actually be a form of abuse. So what we had is so stigma is actually a major barrier to mental health, to seeking for mental health amongst the elderly. And all of this can lead to shame. They feel ashamed of themselves. They feel ashamed of what's actually happening to them. They don't understand some of the things that are actually happening to them. They are ashamed about the way people are looking at them. Yeah, I remember that picture of one elderly, maybe somebody in her early 70s at that time, a woman who walked out of the house. Apparently, she was maybe, she could have been having some dementia. She left home without her clothes on, and she was on the street, and it's a Lagos street. And so you can imagine some of the reaction of people calling names, all sorts of things. She was this, is that. Some people actually wanted to even, physically assault her until some another person in the neighborhood actually came around and rescued her from that particular area. That's the extreme, but it's a reality that still happens in our environment. So some of these things, the stigma is a major part of it. So another barrier is, of course, is that, there's the lack of awareness. Most of us, not able to talk about the elderly, are not aware of some of these and cannot even recognize mental health symptoms. We might just come with these symptoms might be seen as part of the signs of getting old. This is not remembering things. I must want to call one name John is calling Andrew. Want to call Ade is calling Ayo. And we are not noticing that. And then of course it's increasing in severity, in frequency and severity, but people with me are not recognizing it as making mistake. Why are you doing that? Why are you doing that? That kind of thing. And so people even begin to take that personal. So there's a lack of awareness may actually be a barrier as well for elderly people to actually seek mental on their own part, as well as on the part of their family members. Or for family members, it's even good for them not to be aware because they don't want to be stigmatized for the fact that, grandma has a mental issue. They want that, so they don't want that acceptance. It will also be a form of defense, actually. So people believe that symptoms could actually be a part of aging. Another major barrier is the access barriers. In the first instance, the health facilities that the adults, the elderly are supposed to access are so far apart. They have to travel kilometers to get to where they are. People have to, for example, in Lagos, people have to move from about maybe 40 kilometers, that's 80 kilometers, 40 and fro, 40 to access specialist health care in an environment where there's even the transport system is not even friendly to the elderly. There are no easily accessible transport for elderly that they can use, except maybe private vehicles that they can actually bring them. Finance is also there. They get to the specialist center, and it costs so much. It's not most of the services, they still have to pay the same thing that everybody is paying. Then of course, there's also the point of limited specialists. Business specialists that will take care specifically of their mental health. So this can also constitute barrier. Instead of me traveling to that distance, let me just discuss with this person who lives just about a few houses away that can give me either that quick injection or prescribe that quick medication or do some herbal stuff to me, and I'm going to be okay. that they could do that. So another thing, of course, is that there's a difficulty, which constitutes another barrier, a difficulty to express their concern, as a result of the fear for the stigma. They can't even talk about it. They feel the discomfort. They feel they are worried about certain things. They are concerned about certain things, but they are worried. They are unhappy. They can't express that because they don't want to be made fun of. They don't want to be abandoned. They don't want to be taken to the back house because of they might be tagged. Oh, it's like this person is giving us problem. Let's go and keep him or her there. They don't want to be bombarded with medications because the people believe that they are being unruly or they are just being irritable over there. Maybe they are just trying to say their point. Okay, it's like grandpa is getting too argumentative. Double the dose of that medication, Joe, so that they can sleep for another 6 or 7 hours. So they have difficulty doing that. And it's a major problem, and it's a barrier to seeking mental health. Thank you.
Thank you, Mr. Gabriel. And one of the things that he had said very well clearly is the fact that it seems to be a lack of awareness in our environment as to what it is. I would even say, as a matter of fact, that a lot of people who are getting into those age brackets aren't even sure what to expect. They don't even know what it is or what the challenges are, and some of the natural, I would call them natural phenomenal physiological changes that is associated with that age bracket. And so when it comes, it brings on a bit of fear and anxiety because you're wondering why this change. Now, I once met with an elderly woman. She was 72 years old at the time I saw her. And she felt so sad because she wasn't able to read like she used to do. She wasn't able to do some of the things that she used to do. And I was wondering that she was not living in the reality of our age bracket. Because how would you expect yourself to be able to carry on and do the things that you used to do when you were 45, 50? As it's a 72-year-old woman, it's definitely not. And now some of them have lots of concerns of people not just undermining or looking or pushing them away. And we have the tendency of doing that too as a society, because the moment somebody is, maybe 60, 65, 70, and then you want to assign role or responsibilities to them, we tend to say, oh, leave them, they are the old ones. But they are willing to do that because, as a matter of fact, they have lots of time in their hands that they don't even have anything to do. They are bored out of their mind. And so they want to get involved and do know quite a lot of things. And these are things that we must begin to look into if we would break down the stigma surrounding mental health in the elderly ones. Thank you so very much, Mr. Akin Gabriel, for that. Now we'll be moving on, and then we're looking at what are the effective strategies that we can use to promote mental health in the elderly, especially in our society, understanding that, yes, Mr. King Gabriel had said access to facility, limited specialists and all the things are there. Now, how can we what are the most effective strategies to promote positive mental health? Thank you, ma'am.
Okay, so the strategies to promote mental health and to put attention of even younger age group that are listening to this discussion. I think this discussion also speaks to them, because if we are going to promote, our mental health, we would have started preparing for, our old age, to live our old age in grace and in good health. So it speaks to both the younger age group and older age group. Now, when we talk about promoting mental health, we know that mental health and physical health are deeply connected. So we have to look at it again in a holistic way, because the psychological, physical, and social health will come together again to give you mental health, good mental health, mental well-being. So what are those things that we can do, to promote mental health? So at the individual level, it's very important to pay attention to our physical health. Yes, our physical health. And how do we do that? We adopt, a healthy lifestyle. Now, when I talk about healthy lifestyle, that has to do with our diets, what we eat, the quantity and the quality. And foods rich in things like omega, fatty acids are very good for brain health. Foods such as nuts, even Titus fish, your oily fishes, Your vegetables, your fruits are very good in, very rich in omega fatty acids. So healthy eating habits. Okay. So regular exercises, adequate sleep, at least 5 to 7 hours for the elderly, adequate sleep, avoiding alcohol and avoiding, smoking, and being hydrated, because we found out that even dehydration can lead to some of these illnesses. So the elderly needs, to be well hydrated. Now, it's also important to go for your medical checkups. A lot of elderly people have medical conditions, that they are dealing with. They need now and again, to see their physician. Now, it also helps, the medical checkups will also help to prevent anything, any other illnesses, that might come up, to prevent, other medical conditions. And it's, identifies quickly or early, prompt identification of illnesses and prompt treatment of illnesses. So regular checkups are very important. Now, apart from the physical exercise, we need to exercise our brains, cognitive, stimulation. All day doesn't mean we just sit down, watch TV, look at our phones. We need to exercise our brains, exercise our bodies, exercise our brains. And how do we do this? Reading, reading, and reading is a very good way, of exercising one's, cognitive or one's, brain tissue. Now, having said that, other things that you can do to stimulate, your cognitive abilities, things like puzzle games. Puzzle games. For those that are not so educated, playing things like Ayu, our local Ayu, Ludo, playing cards, and so on, can help. Some people, even at this age, will go back to school, to acquire more degrees, just to keep their brains alive. Some will go to theological school, some will go to Arabic school. These things help, to stimulate the brain. Now, stress management, there's a lot of stress, not only in Nigeria, but all over the world. So the elderly should be able to manage stress, resilience building. They should build their resilience, right? And they should prioritize their self-care, especially their mental health. They must prioritize their self-care. And where it's getting too much, they should seek for professional health. Now, those that have sensory impairments, for example, those that have hearing impairments, maybe the use of hearing aid will be helpful. Or, those that have visual impairments, people should not be far from them. They should help them, as that's when necessary. Now, so what are the psychosocial factors that we need to pay attention to promote our mental health? For me, the number one thing in the elderly is the issue of combating loneliness. Loneliness is really, 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 can be really bothersome. I heard about a story about some elderly in an Asian country. What brought this up? The elderly were beginning to pilfer. They were stealing from shops so that they could end up in the prisons because they were living alone. So they felt that if they end up in prisons, they will have company. Now the prison warder started complaining that, rather than do the work of a prison warder, we're now doing the work of nursing the elderly. So that's what I'm trying to say, is that loneliness, can be really, really, really devastating. It can be devastating. So how do we combat loneliness? Not by going to steal in the shops, but constructive ways of combating loneliness. The elderly can volunteer in their churches or in their mosques. We still need to hear from you. You are still an important part of the conversation. Your counseling, will go a long way in helping the younger generation. As I said earlier too, you might want to go to a school or some other activities like joining support groups or associations. Now, even senior groups are coming up. Senior groups is just like a senior club that is, made for the elderly, where they can recreate. They are beginning to come up even in Lagos as we speak. So they can recreate, they meet other elderly, they do their aerobics, they do their massage, their sauna, whatever, and they come back 2 times a week, 3 times a week. And, it helps. It helps to fight loneliness. Now, even family and friends, elderly can reach out to family and friends, not only over the phone. Try and visit people. Try and visit people and connect. Let there be like an intergenerational connection between the elderly and the younger age group. This is what keeps the elderly person alive. So with regards to, I said that we talk about the biological, the psychological, and the social, money, financial security. And we found out that in this environment, the statutory retirement age is about 60 in most civil servants, although they are beginning to increase it in some other professions. But age 60 might be too early an age to retire. I think that age 60 is an age not to retire, but an age to slow down. So retirement needs to be planned for. You know how our pension scheme is here. It could be pretty difficult to get your money, from your pension. Even when you get the money, is it enough to take care of your needs? So retirement needs to be planned for, okay? So that one can have financial security, to take care of their needs in old age. So having talked about that, we'll go to the role of the family and the community. What role do they have to play, in protecting and promoting the mental health of the elderly? The young ones should, especially children, not abandon their parents. We find out that a lot of young people now are traveling abroad, to get the so-called greener pastures. And they might end up, abandoning or leaving their parents to strangers to care for them. Is becoming rampant. And that takes me again to the issue of elderly abuse, which my co-speaker talked about. You leave your parents to a stranger you don't know, they tend to abuse them because caring for the elderly is not easy. So how can we fight against this elderly abuse? We might need to put measures in place. For example, CCTVs, okay, impromptu checks on on these caregivers. Also, it's not enough for you to just say, okay, I implore you, take care of my father or take care of my mother. No, you also need to support the caregiver. If you want the best out of the caregiver, you must support the caregiver and help them with whatever challenges, they might come up. At the level of the government is trying. At least I know the pension thing has, improved. The retirees are now getting their pension easier than they used to get it before. But the government definitely can do more. Provide free or subsidized health care. Healthcare is very expensive. Healthcare is very expensive. So the issue of, health insurance comes in here so that it can be easy, for the elderly people to access good healthcare. Okay, so we need more safe and affordable housing and transportation. Sometimes the elderly want to go out, but because they can't afford, the money to transport themselves, they stay indoor. So if the government can, subsidize their transportation, for example, the BRT, they might have elderly cards, for the elderly where they are entering the BRT bus might be cheaper for them. So the government would need to, help them to subsidize transport and housing. Now, talking about financial security, government can also help to, for them to get their pension easier. Then I want to talk about the issue of the old people's home. The old people's home. Yes, when we were children, it was like a taboo, for you to say you want to put your elderly one in the old people's home. But we are beginning to see that, there's an increased need and increased demand for the elderly home. As far as I know, in Lagos State, we have only one government old people's home. We need more. There are a lot of private old people's home, in the community, but the cost of these places are very prohibitive. So if the government could help to build more old people's home that are affordable for the common man, it will go a long way, in promoting their mental health. And of course, public enlightenment programs, if people can be aware of what mental health and what mental illness is in the elderly, the stigma will reduce and the elderly will feel free, to go and get professional care. I think these are some of the few points, that can help to promote the mental health of the elderly. Thank you.
Thank you so very much, Dr. Ojuko, for that. And then she went into every segment to help us to understand what we need to do if we would be able to manage and as well as promote a positive mental health in the elderly. So it now boils all down to everyone has a role to play. It's not just the government, it's not just the community, the family members, and every other thing. And there were things that she said that honestly, it will begin to put a synergy to it. I do not know where we'll be able to create a balance because if you start looking at the Japa syndrome and how it's leaving most of the elderlies back home and they're missing out in the lives of their children. No, they're missing out in the lives of no, the development, the joy, and every other thing. Some of them can't travel out even when they have special celebrations and all of that. And that is also affecting them. And no, I think for me, it's there's a need for us to begin to rethink. Mr. Aki Gabriel will be talking to us shortly on how ways to now encourage the older ones. Now, we are talking about the people who are 60, 65 in the ball on how to now prioritize their own mental health. Now, this is not an individual doing that for you. This is you doing it for yourself. So, how do you prioritize your mental health? Over to you, Mr. Gabriel.
Thank you so much, moderator, for that. Oh, very interesting, actually. How older citizens prioritize their mental health. I think there are some basic things that we also need to identify there. Older citizens need to feel safe. They need to feel hopeful. They need to feel loved. They need to feel respected. They need to feel relevant. This is still a major, these are major needs that they actually desire. But are they available all the time? For as much as they are not available, it adds to, it can create or lead to issues with mental health. Specifically, when we look at it, the area where we want to look at would be, how we want to ensure that their environment is safe. In talking about even achieving what you talked about in terms of safety, being needed, hopefulness and everything, most of these things have to be done in their own language. At times, most of the time, we want to do things in our own language. It's just almost the way some people actually relate with children. We relate with children with our own language. Most of the time, we need to come down to their level. So with elder citizens as well, we need to also talk to them, relate with them, think along with them in their own language. And their own language is mostly filled with things. What constitutes most of things there is issues with respect. They need respect. They need the recognition that they are still there. They are relevant. Want to speak their language to them. Want to talk to them. Want to play them. They want to hear their music. What time they are in their own area, they don't want to hear the 2025 R&Bs that are going on. They may not, well, some may not actually understand that, but want to play them what we call old school there, which you see them vibing to when you put it on. They want to hear about things. They want to be created in the ways that they recognize, to know that people actually, remember to more or less like honor them by recalling them. They need the respect. Greet them the way that show that you actually respect them, not casually, or with deep sense of respect as well as love, to show that love. Hugs. Yeah, in some culture will do more than that. They will prostrate, they will kneel, they do all that is to show respect to them, which they really look for. They also want to be able to have the opportunity to be able to play their traditional roles. They are the custodians of cultures as well as other things due to their experiences. They want to be there at the naming ceremony. They want to be able to name. They want to be able to carry babies. They want to pack babies. They want to do something. They want to bathe the baby and do some of the cultural things, whether in ceremonies and everything. They want people to sit with them, to talk with them, about things that interest them. Well, so for some of them, they want to talk about 1962. They want to talk about what happened in February 13, 1976. They want to talk about what happened in August 27, 1985. You want to talk about what happened on May 27, 1999. Some of our people don't even know about that time. By the time you're talking about that, who wants to hear all of that? It gets to them. But by the time they're able to share, you see that spark in their eyes, and they're able to relieve some of these things. And because they will connect all of them with the experiences that they had at that particular time, what happened to them, they were really able to relieve some anxieties, some fears, and worries that are associated with those periods, those particular periods. On a personal note, my grandmother told me about some certain things that were very, some of the things that you read in a history books. So these people are actually reservoirs of history. They will tell you living history by the time you are ready. I've worked with an 82-year-old octogenarian who was a driver, to a chauffeur to one of our ex-presidents. And oh man, sit with him. It's going to give you life history about things that happen. So these are some of the things that they want to be able to. We want to also be able to provide them with, environments. We want to be able to make them feel loved. We want to provide them with, make them to feel, that they're happy. I want to normalize so many things for them. We want to encourage them to exercise and talk and play and be with us. Thank you. So these are some of the things that will actually enable them to prioritize their mental health. Thank you.
Thank you. I hear you loud and clear, sir. Sit with them, let them share their story. But sometimes we don't have the time to sit with them to share their story. And sometimes sitting with them can be very, very, distressing for us because they keep saying the story over and you've heard it, but they want to say it again. But like you said, it helps them. It brings the spark back and it helps them. We have some questions on the chat box and then I'm going to take them quickly. Our time is almost out. Yeah, Dr. Dugua, is dementia hereditary? And can it be cured or treated if detected early? Then quickly just add some of the signs. I know you have mentioned that earlier, but this person is still asking, and some of the signs, maybe in just 1-2 words, and then the risk factors. Over to you, ma'am.
Okay, thank you for the question. So dementia is usually not hereditary. It happens sporadically. It happens irregularly. It can just happen to anybody. However, there are some rare forms of dementia, that can be familiar. Okay. So some of the symptoms of dementia, as earlier said, is memory problems, confusion, having generally cognitive abilities, unable to carry out your activities of daily living. And, it gets worse as the years go by. And it's like the person dies twice. The person loses themselves initially, and then the person now dies a physical death. So the person just gradually becomes a shell of their old self. Dementia sometimes can be irreversible. We call them irreversible dementias. Those are the ones to a large extent, that can be managed and it can be reversed. It can reverse to, a large extent. Sometimes dementia can be as a result of hypertension, poorly treated hypertension or diabetes. So if you treat those physical conditions, the dementia somewhat, can be reversed to, a better level. But things like Alzheimer's dementia cannot be reversed. And Alzheimer's dementia is the commonest form of dementia. I hope that answers the question.
All right, thank you so very much, ma'am. Mr. Akin Gabriel, this person is living with an elderly woman who is also having dementia and depression, and then she's requesting to be taken back to her home. And I know that is one problem with the elderly. They want to be in their home, even when they cannot do anything again. Now, if she's not taken there, she's unhappy, she's moody, she's not eating. So how can we resolve this? How can we help this person? Quickly.
Perhaps maybe that person is missing home. I mean, home in this case might represent quite a lot of things. I mean, familiar faces, familiar scenarios, and stuff like that. Yeah, well, at times they may not be able to go back home physically, but you could recreate home where you are right there. What is at home? The comfort, the ability to be able to take a stroll, maybe a leisurely stroll within the neighborhood, accompanied, of course. The ability to be able to have people around who will listen to them, who will talk with them, who will recognize them, who will respect them, who will do things with them. Ability to be able to talk or tell stories to children that they would do at home, and have a comfortable bed. I want to believe these are some of the things that we can actually do. Let's recreate home in our home right there.
Thank you so very much. We curate home in them. I love that. I think that's very, very important to them. Dr. Dugua, somebody's asking more explanation on the kind of diets the elderly person or people should draw on. I know you mentioned diets earlier. What kind of diets they're asking?
Definitely a balanced diet, but they should tilt more to, naturally occurring foods, natural foods. They should avoid unhealthy food. They should eat more of fruits and vegetables, drink a lot of water. Now, the elderly might not be able to eat like we used to eat in our younger days, so they might need to watch their portions. So, as I said, it's not only about the quality of the food, but also the quantity. So foods are rich, as I said, foods are rich in omega fatty acids and other healthy acids. Are your fruits, your vegetables, your nuts, your fish, your olive oil, for those that can afford it, and so on. Your grains, legumes like beans, those are healthy foods, So
Thank you so very much. Mr. King Gabriel, I want you to take this for us. Aside cognitive stimulations, I know one of you mentioned that earlier on, reading and other things like that. How would the elderly benefit from music, and what importance will it have to their life?
Did you say music?
Yes, sir.
Oh, music is wonderful. It's actually one of the biggest things, especially if the cognitive functions are still intact. It brings a lot of memories. It suits them. It's get them comfortable. They feel safe because they are hearing familiar voices that they can associate with when at a period when they are safe and good and very comfortable. So music plays a long way, especially well in this case, traditional music that they enjoy, the juju, the high lives, and everything, and what that they know that they enjoyed at that time, play it for them. You find that most of the time you've seen them singing along. The lyrics most of the time we have personal meaning to them that they will be able to actually go along with. So music plays a very, very big most of the time. Have music playing, their music playing in the background at home. And of course, favorite radio programs as well. That also there's so many favorite some radio programs that have been running for a very long time that they also listen to that will also help. Thank you.
All right, Dr. Jogora, thank you, sir. At what age does dementia set in?
dementia will set in, usually in old age. We call that the senile dementia. So old age for us is 60 years and above, usually. However, it can start before age 60 years, especially if the person has lifestyle diseases that is now leading to dementia. So it can happen usually at any time, before or after old age.
Okay, thank you so very much, ma'am. Mr. King Gabriel, I know you listed out factors that could affect an individual, having mental health and all that. But there's a question here. Are there disease conditions or medication that can make an individual or that can promote aging? Is it promotes now or make people to age beyond what they are, especially in the youthful stage? Yes, ma'am. Yes, sir.
Oh, yes, of course. Thank you so much for that question. And I think Dr. Lugo has mentioned quite a lot of them, especially food. Yes, some people talk about medication or maybe food supplements that could also be, but of course, good food is totally a major part of it. But most importantly is living right from the beginning. We are talking about an aspect of a developmental stage at this period, the latter end of it. But I mean, the whole thing started right at the beginning from childhood. That's when the whole thing. If you can be more mental health aware from the beginning, both from family members as well as the individual themselves, most of this the quality of life should improve even in adulthood. If there's no one-on-one interference, but most of the time it will actually improve, make it better and feel better if you're able to now note most of these things from the beginning.
Thank you so very much. We'll just have to wrap up on this stage. Now, Dr. Duga, can we take your last word, ma'am? Your last word to our audience, please.
Okay, thank you. So my last word will be that it's very important for us to value our elders, and we must include them in the conversations. We must ensure that they feel seen, they feel heard, and they are respected. I think those will be my last words.
Thank you. Say very respected. Thank you, Mr. Gabriel. Your last word.
Yeah, well, I would say our elderly citizens, they are wonderful people. They are quite a great fun to deal with, and they are a depository of quite a lot of things that can all benefit from presently. Thank you.
Thank you so very much. We want to appreciate everyone who has been on this call with us. We are always very excited. Each time we'll call and then you respond. So thank you very much for being on this call. Please remember that we have a YouTube page where these recordings as well as previous episodes of the Yaba Voice recording can also be found. So please, you can visit. And please note, one of the things you can do that would make us happy is that you can like us and then you can share. So subscribe, like, and share.
If
That
you would
would
like to
really
follow
make
this
us
with
very,
the
very happy.
subtitles
Until we
in your
come your way
language,
again,
you can choose
please stay
the
safe and ensure
English
that the
language in the
elderlies
menu
need
and
to feel
speaking on the
safe,
screen
they need
now.
to feel hopeful, and they also need to be respected, and then they need to feel very relevant. So please ensure that you make them safe, hopeful, respected, and also relevant. And also note that even as we are aging, we have a responsibility to ourselves also. Take care of yourself. Awareness is important, and then be actively involved in ensuring that you age effectively. Until we'll come your way again, where we'll be talking about social media addiction and mental health. How do we balance the hot? We stay safe. Enjoy your mental health. Bye bye.